Well, February is American Heart Month. It's a time to learn more about what we have to do in our lives that contribute to things like heart disease, but more importantly, what we can do to prevent it. Now, one of the most serious things when it comes to your heart is a heart attack, and knowing the warning signs could save a life. All right, now our sponsor, the Detroit Medical Center, is home to specialists who can provide care for your heart. And joining us to share his expertise is Dr. Aziz Al-Khatib, an interventionalist cardiologist at the DMC. Thank you for being with us.
Thanks for having me.
Well, let's start by you telling us what is happening during a heart attack and why it happens.
Yeah, a heart attack is most often caused by the buildup of plaque inside the coronary arteries. These are the arteries that supply the heart with blood and oxygen. If that plaque were to rupture, it could lead to a clot formation and cut off the supply of blood to part of the heart, causing a heart attack. Now, the plaque builds up for multiple reasons, but mostly due to our bad habits like smoking, eating an unhealthy diet, and being too sedentary.
Okay, now what are the warning symptoms of a heart attack? You know, are there things that we should remember and keep an eye out for?
Yeah, most heart attacks involve pain or discomfort in the center of the chest. It's usually described as a heaviness, a squeezing or pressure sensation, and it lasts longer than just a few minutes, or it can go and come back. The pain can involve other parts of the body, like one or both arms, the back, the neck, the jaw, or even the stomach. Other signs include shortness of breath, breaking out in a cold sweat, feeling nauseous or lightheaded. If you think you might be having a heart attack, it's very important to seek medical attention right away. These are not symptoms that should be ignored.
Okay, that's good to know. Very good to know. Now, many people struggle with high stress or maybe some mental health issues are concerned. And could those things be affecting the heart? And can these issues lead to a heart attack?
Yes, absolutely. So chronic stress and anxiety activates the body's fight or flight response and releases hormones like adrenaline and other stress hormones, which over time, excess exposure can lead to negative health effects like raising your blood pressure, causing damage to the arteries, and leading to heart disease and, yes, even heart attacks. So stress management is an important part of being heart healthy and shouldn't be neglected.
All right. Sometimes we thrive off of stress, but it's not good. Excess is not good for us.
Right.
So what are the treatments for a heart attack, and then what is the recovery like?
Sure. One of the common treatments is to perform a cardiac catheterization, which is a minimally invasive procedure used to open up blocked arteries through angioplasty or placing a stent. Medications for blood pressure, cholesterol, and blood thinning medications are often prescribed for a period of time. And finally, we encourage enrollment in our cardiac rehabilitation program, which is a medically supervised program designed to improve your heart health and provide support and education after having a heart attack.
All right, so there are options out there. Dr. Al-Khatib, thank you so much for being with us.
My pleasure.
We've got some enlightenment on all of this. Now, you can take a free online heart risk assessment to better understand your heart health by going to the DMC website at dmc.org/hearthealth. Again, that's dmc.org/hearthealth.